And welcome to Houston Newsmakers. Actually, we're talking with Congressman Crenshaw running for the re-election in this seat. We've been talking about the issues in his district, talking about the president, talking about a lot of different things here. Congressman, what's the biggest issue you think it needs to be resolved for your district going forward here? What do you want your constituents to know that you're working hardest for?
I think healthcare is on everybody's mind these days, especially in the midst of the pandemic. So one of my favorite projects that I've been working on, we're going to release legislation on this soon, is direct primary care. Direct primary care, I think, is the future of a doctor-patient relationship. It's the future of free market care, and we can make it accessible to everybody. And the way you do that, when we have to expand HSAs and we have to expand the incentives for doctors to get into this model. It's basically a subscription service, and it's really successful. And I can't wait to share more details on it. But Americans are sick of paying too much for their healthcare, but we also can't undermine the foundations of our innovative healthcare system and quality healthcare system, which would happen if you had something like Medicare for all. So you've got to be able to do both, and you have to have smart, honest conversations about how to do that.
That'll be great to see that happen. I know that when you first went, we talked a couple of times before you went to Congress, you were optimistic about being able to go and take your attitude to be able to bring some kind of compromise together, not be this deep silo partisanship. How disappointed are you that you haven't seen more bipartisanship in the House of Representatives?
Yeah. And I'm considered one of in the top third of bipartisan members of Congress, according to Georgetown University. Always willing to jump on a piece of legislation that solves a problem within a proper set of principles and a proper framework. It's been disappointing. This week is a good example of that, where, look, the Democrats will always want to spend more money than us on anything. And I don't see why we can't at least this is talking about COVID relief, right, for small businesses, for schools, and et cetera. The Senate just passed that along party lines yesterday. That's very disappointing. It's not like Democrats disagree with what's in the bill. That's not the issue. They just think it should be more.
Right.
A compromise would just be vote on what we agree on. I mean, this is I get it sometimes that you need to play politics, to negotiate, but this isn't one of those times. We could easily just agree on this stuff and move it forward. It's very disappointing that we haven't done that.
What would you do differently, you think you suggest doing differently as a country in this response to COVID? If you could have an opportunity, I know it's kind of difficult to look back, but we clearly, we have more deaths. I mean, we kind of not doing well in terms of comparison to the rest of the world in terms of our deaths per capita as it is now. We're getting better, but what would we do differently, do you think?
Yeah, well, that's actually not true. I mean, on deaths per capita, we're in line with places like, we're doing much better than a place like Belgium. We're about like France. And if you take New York City out of the mix, we have actually some of the best performance. So it's really only in a very small area of the country, which is the Northeast, that we actually performed badly. If you look at Texas per capita death rates, we outperform just about most other countries. So it's not exactly true, first of all. And I know that's the media narrative, but it's just false. And it's designed to make people more scared and frankly, angry at their country. So what would we do differently? First of all, we have to disabuse ourselves of this notion that there was no national plan. If there was no national plan, then what's Operation Warp Speed? Okay, what's Operation Air Bridge? Over 250 flights of PPE into the country when China was hoarding it. Back in February, President Trump had all of these private companies at the White House to create a public-private partnership to create more ventilators, to create more PPE, and when they moved into massive mobilization. What would we do differently? Well, I think we know in hindsight, and I think we should have known at the time mostly too, that universal lockdowns, just shutting down the entire economy, has massive consequences and very little benefits. Again, we know this in hindsight, and you can compare California and Texas, for instance. Our spikes happened at the same time, and our declines are basically in line with each other. Our death rates are around the same. And yet their economy is absolutely destroyed. Why? Because they do a more universal approach. So very little extra benefit versus a targeted approach here in Texas where, listen, we close down bars, close down big events, and we use some common sense. All right, you wear masks, you don't do huge events, but you also don't destroy your economy. And politicians I think, chose the costliest possible options and then virtue signaled about it and moralized about it, called anybody else who disagreed with them a murderer. And it was so dishonest, and we really have to learn our lessons because people's lives have been destroyed because of these really bad policy decisions. And so a more targeted approach and actually looking at the data. Don't just scream, listen to the science. All right, that doesn't mean you're listening to the science just because you're screaming it over and over again. You actually have to look at the data and look at trade-offs, look at costs and benefits, and take a real analytical approach to problem solving in the midst of a pandemic.
Congressman Crenshaw, I really thank you for your time. It's always good to be able to talk to you in intellectual, deep conversation. You know, we need about a half hour for this as opposed to the time we have. But
we can do it next time.
Okay, all right. I'm holding you to that. We have it on record. We have it on tape. Thank you, Congressman. Good luck to you. Stay safe on the campaign trail, and we'll look forward to talking to you soon.
All right, thanks, Gabriel.
Houston Newsmakers Extra. Share it with everybody you know.